Thank you for joining our weekly press conference. Again, I'm Commissioner Tracy Brown, and join me with the panel today are Drs. Bean from IU Health, Dr. Wickert from Franciscan Health, Mayor Tony Rosworski, Mayor John Dennis from West Lafayette, and County Health Officer Dr. Jeremy Adler. We are again streaming live on Facebook and on Tippecanoe County Government's YouTube channel. And would like to turn things over to Dr. Adler at this time.
Thank you, Commissioner Brown. Good afternoon. Thank you for joining us. As many of you are aware, the United States has surpassed 1 million confirmed cases of COVID-19. There have been 58,471 deaths across our country. Here in Indiana, we have 17,182 confirmed cases of COVID-19 with 964 deaths. Here in Tippecanoe County, as of today, we have 102 confirmed cases, and our deaths still remain at 2. The County Health Department has been collecting data on suspected COVID-19 cases here in our county. So far, we've had 5 reported suspected cases. The Indiana State Department of Health is also now collecting data on clinically diagnosed cases of COVID-19. The only data that they have released as of today are probable COVID-19 deaths in the state of Indiana, and that number is 101. Locally, over 3,000 coronavirus tests have been performed, both through the Indiana State Department of Health, our hospital laboratories, and commercial laboratories. More testing is on the way. The Indiana State Department of Health announced yesterday that there'll be a new testing site starting in Lafayette next week. It will be located at the Lafayette National Guard Armory. This testing site will provide free testing for people with symptoms consistent with COVID-19, close contacts of COVID-19 cases, and people living in congregate living settings. In addition, the State Department of Health is undergoing a COVID-19 study where they are testing randomly selected individuals throughout the state to see if they have the virus but are asymptomatic, or if they've had the virus in the past. This testing will take place several times during this year. The Indiana State Department of Health is in fact in Lafayette today performing this testing here locally. That testing will be very valuable in terms of getting a better picture of how extensive the coronavirus picture is in our state. As many of you are aware, Cass County has had a significant surge in COVID-19 cases related to the Tyson meat processing plant there. They have 1,125 cases. This situation in Cass County is a stark reminder for all of us of just how quickly this virus can spread, especially in settings with close contact. We expect here that this outbreak in Cass County will have an impact on our local hospitals, as some of those patients will require care at either of our local hospitals. In addition, the situation in Cass County does make us cautious for our local businesses and organizations, and of course has implications for possibly reopening our community, our businesses and organizations in the near future. Here in Tippecanoe County, 5 of the Tyson cases are Tippecanoe County residents. As we discussed last week, the projected surge of COVID-19 for Tippecanoe County is still expected to occur during the first or second week of May, along with the rest of the state of Indiana. For this reason, it is very important that we all stay the course at this time. We need to continue with our social distancing measures. We need to continue following Governor Holcomb's stay-at-home order. We need to be vigilant about avoiding large crowds. We need to be very meticulous about hygiene. These are the measures that are going to help us stay healthy and help us prevent a massive surge in our community. This week, the CDC did update their symptom list for COVID-19. Now, in addition to cough, shortness of breath, and fever, the CDC has added the following symptoms as possible COVID-19 symptoms: chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. In addition, the CDC revised its testing criteria for COVID-19 on April 27th. The testing criteria had previously been divided into 4 priority categories. The CDC has simplified that into 2 categories. One is called high priority, and the other one is priority. These changes should assist with providing testing to more individuals. A topic that has been discussed much both locally and nationally is the reopening of our community. Here locally, much will depend on Governor Holcomb's executive orders, which are due to be revised or released on May 1st. We believe that any reopening needs to be done in a very careful and gradual process based on coronavirus data, both locally, regionally, and in our state. Any sort of reopening will likely involve significant changes for businesses and organizations. And it's important to remember, with our surge yet to happen, we are expecting that most of Governor Holcomb's orders will probably remain in place with possible small changes. That being said, many businesses and organizations have been planning for the reopening process, and it's important that those businesses and organizations take into consideration modifications to their operations that will help ensure the safety of their employees and their customers. These modifications should optimize social distancing and help to protect both employees and customers. We feel that these plans must be done carefully and must be approached in a very serious manner so we can protect our community from COVID-19. At this point, I'd like to open the floor to our other panelists for any comments.
Sure. My name is Jim Bean. I'm Chief Medical Officer at IU Health Arnett, and I'll just highlight that the surge of patients and cases that Dr. Adler referenced occurring in Cass County is starting to affect our local hospital. We have had a number of patients admitted over the last few days, and our current census is about a dozen patients with COVID-19 and a similar number who are under investigation. So higher numbers than I reported last week and than we have been seeing over the last few weeks. We are in stage 2 of our surge categories. We have a 5-stage surge plan, so we are well in control, have adequate capacity and adequate staff and PPE to handle what we are currently seeing, but we too are aware of and concerned for the volume of positive cases that are occurring to our northeast.
Thank you. Other comments?
We'll let Dr. Wickert go.
Okay. We are seeing the same thing. Interesting how the hospitals about a couple miles apart are very, very similar. So the number of positives we have is about a dozen, with about a similar number of suspects or people under investigation. So we have seen that number increase substantially from last week, and much of that has been from either Logansport area or the Cass County area, and also we have also seen some individuals from Montgomery County, from the nursing home in Montgomery County. That also has a number of people that tested positive. We continue to look at how we plan for surges and how we plan for reopening and how you mix all those together and come up with a plan that works to keep people safe and to keep our staff safe and patients safe, and also to take care of some of the needs. It's been 6, 7 weeks, 8 weeks close of individuals who have delayed potential care, and so we are trying to figure out how do we do that safely, how do we do that well in a coordinated plan.
Thank you, Dr. Wickert.
I would just like to reiterate, without being redundant, though, that as Dr. Adler and our other medical professionals said, that the situation in Cass County is affecting our community and will most likely continue to affect it for some period of time, and we cannot lose sight of that as we make decisions here locally about what we need to do and how we stay the course in an effort to ensure that we keep our numbers here as low as possible from the county. We've all done a very good job of that up to this point, I believe, for as large a county as we have, and statewide per 1,000 of population, our numbers are very good. But we all need to understand and keep ourselves educated that what happens outside our county and in our region can affect what happens here at home and the decisions that we have to make to ensure the safety of people in our community, and that we're working closely with our healthcare providers to help ensure that that surge, combined surge now maybe from an area other than our own, is still can be managed in a way that it doesn't overwhelm the healthcare systems. And I think that's important for everybody to look at this in that regional concept, that is going to be necessary as we make decisions.
Mayor Dennis?
Well, very similar to what Tony said, but we always experience changes in behavior when the weather changes. And because of the prolonged restrictions that we have had on our population base, the tendency is for people to be sort of saturated with information, and then with the nicer weather, go back to old habits. Going back to playing tennis, going back to going on playgrounds, going back to having picnics and doing things in public areas where it's difficult, if not impossible, to keep the social distancing requirements. I want to reemphasize that we are still in the early stages. We still have no way of knowing how long this is going to take or how long it's going, what the exposure issues are going to be. So continue to mind the social distancing. Only do what you have to do. I'm getting a lot of complaints about the fact that our law enforcement folks are now going onto playgrounds and asking that moms and dads and families take their children home. These guys are just trying to do what's best for the community. I'm getting complaints about people saying that we are turning into a police state. No, we are not turning into a police state. But when the officers recommend that you might want to leave an area, I think the best thing to do is to use that as an example for future visitations to those areas. It's challenging times for us all. We have to modify our behavior because we know one thing: if you keep your social distancing, this thing will eventually go away. But the weather should not be a reason or some sort of rationale to go out and think that things are better. I know we're a social population, humans are social animals, but for the near-seeable future, please, please restrain and keep your social distancing.
Thank you. Commissioner Brown?
I would just echo the sentiment from the mayors. We may open up, but we're not prepared to give up ground. We need to, again, stay the course and do what we've been doing, lest everything that we've accomplished be for naught. So we're not out of the woods or even close at this point in time. So,
Great. Thank you. Great comments. I'd like to now open the floor to questions.
Dave Bangert with the Journal and Courier. Can you guys hear me in there?
Yep.
Yes.
Okay. Mayors talked a little bit about regionalism. And I know Monticello has a new executive order. Logansport has an executive order. Are there chances that that might happen here? Something similar with tighter regulations, either from the health department or from the mayors, for how many people can go into stores, those kinds of things.
Well, I think
Have you seen what the mayor in Monticello and Logansport did?
Yes.
Yes, I
Okay.
have. I mean, I think for us here locally, I can only speak for myself, obviously, but we have, through this whole period, worked very closely, collaborative here with We did a countywide declaration, working with the health department, the two cities. I would guess that we would continue that we would continue as one group here in what we do in our county. I think that's proved very helpful. It's proved very beneficial. I think our numbers here demonstrate that, and our preparedness demonstrate that. So I would not see myself deviating to do something on my own that's different than what this group here and collectively would deem would be appropriate for our county.
And we've lost half of our population. You know, the students are gone. And the static residents are very compliant when it comes to making sure that they're abiding by the necessary standards, the new standards that we've established for general health and well-being of our citizenry. We do have the occasional acts of irresponsibility, but they're few and far between. I think overall the messaging has been very consistent, and people understand that this is something that we're going to all have to work together on collectively, both healthcare as well as elected officials and political jurisdictions, to make sure this goes away. I've had contact with the mayor of Logansport, and they're in dire straits right now, and we should send them our thoughts and prayers. It's a challenging time, and the volume of cases that they have is just, how do you prepare for that in such a small community? I don't want us to be that way. And so I think it's imperative that we continue to do what we need to do to make sure that folks are going to be healthy.
Yes. And from the health department's standpoint, as a health department, we would only make recommendations like that if our case numbers here suggested that such steps were needed. And of course, those decisions would be made with collaboration with the folks sitting up here at this meeting. Let's hope that we don't have a significant surge that requires measures like that.
How many cases would it take to get us to that point, Dr. Adler?
I don't know if I can put an exact number on it. It probably would be a rate of increase in our cases. So if you see a doubling or tripling of our numbers in a short period of time, in a matter of days, that would necessitate consideration of other means to help control the situation. But again, any decisions about more restrictive orders and things would only be made with careful consideration and thorough discussion with our elected leaders.
Hi there, Meredith at WLFI. So obviously our cases compared to Cass County are vastly different. Why do you think that is? And is there any concern that we could end up how Cass County is at this point?
Well, I think that what's happened in Cass County is a reminder for all of us of exactly what the potential of this virus is and how quickly it can spread, especially in a setting where there is prolonged close contact. And so what happened in Cass County, I think, could happen anywhere, not necessarily just in a factory setting, but in any other kind of setting where you have a large number of people in close contact with one another. As to why we have not had something like that happen here, I think is at least in part due to the measures that everyone in our community has taken to help prevent a massive surge in our cases. The social distancing, the staying at home, the avoiding of crowds, the increased hygiene, the focus on those sorts of measures, I think has paid off and has really helped our community. We're still expecting our surge sometime in the next couple of weeks. We don't know, though, to what extent that surge will be, but we're hoping that with the continuation of these measures that we can minimize the surge in terms of its numbers and its impact.
Jordan Smith with the Purdue Expo.
When that surge takes place, is that something where you would maybe implement or advise people to wear masks like several of the other mayors have made a, proclamation for them to do that?
Yeah. Well, we've already recommended to the general public that they wear masks, especially in settings where social distancing is difficult, such as grocery stores, pharmacies. That recommendation is consistent with the CDC's recommendation for masks.
Jordan Smith with a Purdue Exponent. President Trump plans to invoke the Defense Production Act to reopen meat processing plants. What are the unique safety challenges characteristic of these plants?
Well, I can't say that I'm an expert on the meat packing processing facilities and how their factories and facilities are set up. But I think that most of these facilities are set up so that the employees are working in very close proximity to each other for an extended period of time. And it's that proximity, I think, that really is where the problem can be. So it's not just, in my opinion, specific to just meat packing plants, but it could happen really in any sort of facility where people are in close contact for a prolonged period of time.
Dr. Adler, do you have advice if the governor lifts stay at home? Do you have advice for hair salons, advice for restaurants? You said be careful and deliberate and things along those lines, but what specifically should they be thinking about if they want to reopen?
Well, I think that the governor's orders will likely be extended. There may be some small changes, but I think with what we're seeing across the state, I'd be surprised if there were any significant changes or lifting of his orders. That being said, I think that the advice that we would give would be to follow the same directives that are currently being given to essential businesses, and those are directives that we've spoken about at several other press conferences. And those are really ways of modifying the operation of a business to optimize social distancing, to help protect employees and customers. And those measures are outlined in Governor Holcomb's orders, but they include various things such as having hand sanitizing stations available to employees and to customers, having signage reminding people about social distancing and hygiene measures, having marked spots on floors to keep people at the 6-foot distances, only having one member of a family go into a store for shopping, various measures like that, encouraging sick employees to stay home, and so on and so forth. I think these sorts of things would be very helpful to any business as they consider the reopening process.
Susan with Facebook Live. How can we request PPE? My husband is an oral surgeon and we have had no response to requests.
As everyone knows, PPE has been an issue. There's been a limited supply of PPE, not only locally, but also nationally. The health department did receive some PPE from the national stockpile. All of this PPE was distributed to long-term care facilities and to first responders. we're not certain if we'll be receiving any more PPE. If we do, we would like to be able to make that available to other healthcare providers, but I don't know if that's going to happen. For the situation that you mentioned with the oral surgeon, I'm not sure if the office has tried to order PPE through their supplier. That would be, of course, a first step. I'm not sure if the Dental Association has any additional plans for providing PPE to its providers.
For Mayor Dennis and really for the whole group, are you rooting for Purdue to open or to not open after hearing what Mitch Daniels had to say on the subject last week?
Well, I think first off, he is looking to open. I don't know generally what he means by that. I know that they are making proactive steps to see if it would be safe to open Purdue University. And he's got the best scientific minds and the best practices at Purdue to ensure that should he choose to open, that it will be safe and that campus will be a safe place to be. But there's so much unknown right now. Remember, this is projected out for the fall semester. There's so much unknown right now. Personal opinion, would I like to see the students come back to Purdue? Most definitely. Would I love to see the community get back to normal? Absolutely. But would I want to do it and then place another 45,000 people at risk? Absolutely not. So there are protocols and procedures that need to be taken care of in order to make sure that this is a practical, logical, and safe decision to make. And if there's anywhere where there's the right folks and the right place to do it, it's Purdue University.
This is for Dr. Bean and Dr. Wicker. Last week I had talked to you. The governor announced that hospitals would be allowed to resume elective procedures. Last week there was a planning process for that. With the surge still set to come, is there any concern that there will be a shortage of PPE, or will that change if we do get a surge?
So there's always a concern that there's going to be a shortage of PPE. It's unpredictable what's going to happen, though we do anticipate cases numbers will continue to grow. So this is something we pay close attention to every single day. And in regards to the re-expansion of elective procedures, we're continuing our planning process for that. We anticipate beginning a small number of elective cases starting next week. And and we're moving forward with that anticipated plan, recognizing that if the next few days play out in a more concerning way, we may need to revise that plan or step back from it. But right now, we're able to move forward.
I just came from, we had about a 3-hour meeting talking about this very question before I came here, and how we as a system deal with this issue. We're looking at it, it's not just Lafayette starting, it's IU and Franciscan starting, and all the hospitals in their system, all the hospitals in our system. So we really have to pay close attention to how much are we using today, how much supply do we have, and what happens if we increase that burn rate or that use rate? How do we be good stewards of what we're using? We're disinfecting N95 masks, which will increase the number that we actually have. How well are we doing with that? So it's all those components that have to be a part of this plan. We've looked at it from a service line standpoint, from not only surgery, but also outpatient procedures, diagnostic procedures, radiology procedures, all these different procedures that have been delayed for the last 6 to 7 weeks. How can we bring them back online in a safe manner, in a manner that doesn't expose individuals that should not be? It doesn't put us in a dire situation. Now we're not having enough PPE. So we thought that it was challenging to slow everything down and to stop. It's equally challenging to try to figure out how do you resume back up safely and carefully in the environment in which we don't know what's going to happen. Last week we were here, we didn't know what was going to happen in Cass County. We didn't know what was going to happen in a nursing home. And those things will continue to change our plan. So we try to communicate to everyone. We may schedule for next week, but things could easily change in the sense of we would have to ramp back down or stop. And we'll just have to see how that plays out.
Dr. Adler, specifically about Tippecanoe Mall and Simon kind of jumping, or at least anticipating a lifting of the stay-at-home. Do you have any concerns specifically about that, or is that just the same as dealing with, say, a Menards or Lowe's that has already been open and fairly crowded at this point?
So, of course, the opening of Tippecanoe Mall and any other non-essential business is, of course, contingent upon the governor lifting or modifying his executive order, and we won't know about that until Friday, May 1st. There's always a concern in any sort of setting where you have a large number of people congregating. That's a situation where a virus like coronavirus could spread easily. So it's really important for those businesses to take steps to mitigate the spread, the potential spread of the virus. The Simon Mall Corporation was able to share with us their corporate plans for mitigating COVID-19 in their malls, and we reviewed those, and they were good plans. We had a few comments for them we shared with them, but overall they were good plans that were very consistent with the measures listed in Governor Holcomb's executive orders and also the measures that we had provided to area businesses as directives for protecting customers and employees. So I think that reopening of any business, particularly a business that will have a large number of customers, has to be done very carefully. There have to be significant modifications to the operations and the way things are done so that you can help to prevent the spread of the virus and protect your employees and your customers.
Are we getting any closer to doing demographics for the 102 cases that we have in the county in terms of gender, even Lafayette versus West Lafayette and unincorporated? Anything along those lines now that we're getting into some more mass?
Yeah, we're looking into that. It's one of many things on our list of things to do.
In some states, they have kind of left it up to counties based on the number of cases that they've had, if they partially open up or open back up. If that was a decision by the governor, hypothetically, where would Tippecanoe County stand when it comes to that?
I don't think the governor is going to leave it to the counties. That hasn't been his process thus far. I think that we would really have to look at the number of cases we have and also when our projected surge is going to occur. And again, that's supposed to occur in the first or second weeks of May. So from my standpoint, it would not make a lot of sense at this point to really reopen our community when we haven't even experienced our surge yet.
Emily Seiberg from WBAA. Is there any sense of how many people, both from Tippecanoe County and surrounding counties, might have showed up for the testing at the OptumServe Health Services site in Lafayette? How might a large influx of confirmed cases impact health department, city, and county responses and planning to mitigate virus spread?
So the OptumServe site will not be operational until next week. That's the ISDH in state of Indiana testing site that's going to go into the Lafayette National Guard Armory. So it's difficult to predict exactly how many people will utilize that service. We're glad to have more testing capabilities because that will allow us to identify people who do have coronavirus and treat them appropriately. It will also give us a better picture of just how extensive COVID-19 is in our community. So we're very pleased that we'll have an additional testing site available next week. Will it result in more positive cases? Likely yes, because the more people you test, you're going to uncover more cases. But when you do that, you also are able to then isolate those individuals so that they don't spread the virus to other people. And you're also able to quarantine their close contacts so that you are helping to contain or mitigate the virus. So although it will, of course, increase our numbers of positive cases, there's a good side to that because it allows us to treat these individuals appropriately and really takes the necessary steps to help slow the spread of the virus.
Just to be clear, we know that the cases in Logansport connected, Crawfordsville has some connections. Have you found any connections that are bigger in Tippecanoe County, or is it still fairly spread out in how they're distributed?
The only, well, as I've said in previous press conferences, the majority of our cases are individual cases, or they are linked to another case because they are close contacts, family members, so on and so forth. We do have one small cluster of cases in our county of individuals that reside in a supplemental living facility where 8 individuals and 4 staff members have tested positive. Those individuals are being isolated appropriately at the facility, and the facility is taking all the correct steps to manage the situation.
Thea from Facebook. There's a hair salon near campus that has been seeing customers for at least several weeks, and one client reported no masks. Are they in violation?
Yes, they are. Hair salons were specifically closed by Governor Holcomb in his executive order, so they should not be operating. And if there are concerns about that operation, that can be reported to the IOSHA, the Indiana Occupational Health and Safety Administration.
One thing, if you do read questions inside, if you could repeat them from the, we hear better when Dr. Adler or the mayors are speaking, just technical point. Could you define what a supplemental living situation is? I mean, what is that? Is that a nursing home? Is that a group home, or what?
Yeah, so it is, it's not a nursing home or a long-term care facility. This is a small facility that cares for a vulnerable population in our community. It is small enough that in order to protect the privacy and safety of these individuals, not able to reveal the name of the facility, but it is a small residential facility for a vulnerable population in our community.
Question from Facebook Live. Please explain the exact parameters of being tested at the new site next week and who can go.
Well, the exact parameters I don't have because we just learned about this site yesterday after the governor's press briefing. The only information I have is that the testing will be free. It will be for people who have symptoms consistent with COVID-19, close contacts of people with COVID-19, and for individuals who reside in congregate living settings. As the site opens up, I'm certain there'll be more specific information released from the State Department of Health about their testing capabilities and criteria.
Dr. Adler have any guidelines at this point for Ppe operations in our county? Strawberry season will be starting soon.
I'd have to look into that. The governor's order does allow for certified farmers markets to continue operation. I'm not certain about an operation like that where customers go and pick their own produce. I'd have to look into that and see if there's any guidance from the governor's office about that.
Just to clarify also, the order on large gatherings into the summer, do you see that lifting if the governor changes his guidance on stay-at-home, or will that continue through the date that you've already set?
Well, if the governor makes significant changes to his executive order and lifts a lot of the restrictions, we would likely need to lift or modify our order, because the governor's executive order does specifically say that a locality cannot impose stricter restrictions than what are imposed by the governor's executive order. Again, I think, just trying to predict the future, I think it's unlikely that there'll be significant lifting of the governor's orders, at least at this point, with the surge still projected to occur in the next few weeks. I think we'll be seeing a continuation of the governor's executive order. Again, we won't know for sure until Friday, May 1st.
Has the governor checked in with the county health department at all about your feelings on this, or has he checked in with mayor's offices, or has been pretty much the governor's show?
I've had no contact from the governor's office.
Just limited, just questions and answers about specific issues.
They have been very good, though, about answering questions and working with local elected officials if you have questions or concerns or trying to get answers. I've called on their staff several times. So there has been a good communication, but I think they're experts, and they're the State Department of Health, and they have a good team that's working together to, as we are here, to try to make those decisions for the state of Indiana, and I think they've done a good job with that so far, and will continue to do so.
Yeah, just to clarify, I may have misunderstood your question. I thought you were asking if the governor's office has specifically reached out to our health department. They have not, but our health department has been in contact with the governor's office, specifically their critical business hotline, where we've had to have certain questions answered. And of course, we've had contact with the Indiana State Department of Health quite frequently.
Yeah, just to clarify that question, it really was about whether the governor had been asking for local opinion about whether to lift that order.
Okay, yeah. We at the health department have not received any questions like that from the governor's office.
Question from Facebook Live, Elizabeth. A lot of Little League organizations are planning on starting May 15th. What are your thoughts on this?
Well, again, a lot will depend on Governor Holcomb's orders. Our current order in our county for mass gatherings does specifically prohibit sporting events, and Little League would be considered one of those, and that order is through June 30th. Again, that could change depending on the governor's orders, but for right now, Little League organizations would fall under that order.
Another question from Facebook Live. If or when the county begins to open, what guidelines will you have for personal or family gatherings?
Yeah. So I think that the guidelines that we would be looking at would be really taking a good look at the size of the gathering, the nature of the gathering, trying to minimize as much close contact, particularly with vulnerable individuals. It's important to remember that the current governor's order does not preclude members of a household from getting together and doing activities together. But we'd want to give people advice and guidance on the safest ways to have family get-togethers. So that would involve more attention to hand hygiene, to disinfecting surfaces. There might be a recommendation for wearing masks, measures like that would hopefully help protect everybody involved in the gathering. Are there any additional questions? Okay, any other comments from the panel?
Well, I'd just like to say that, like many of you, we are waiting on instructions from our governor, and I trust that he has clearly assembled a team that is very knowledgeable and understands what we're up against here. Regardless of what the decision is on Friday, let's say, for example, the decision is that the restrictions, some of the restrictions on the stay-at-home order are going to be lifted. I think we need to remember that that should not cause an immediate diminishing of common sense, and that although we could potentially see things change Friday or even 2 weeks from now, we still have a lot of tools available to us that are likely to be with us for quite some time, including social distancing and just being mindful of gatherings and personal protective equipment and things like that. And it would be very unfortunate if we did anything that put us anywhere other than the direction that we're headed right now. It would certainly make everything that we've accomplished in the last month, it would neutralize that. We'd be fighting the battle all over again. So again, use common sense and understand that even if we're given some of those opportunities to get outside and do things that we haven't done before, again, just apply some good common sense to that.
Thank you. Excellent comments. Thank you, everybody. We'll see you next week.